your cells are listening to all of your thoughts. And so the component of that is, what are you telling them, right? I like to say this is a dangerous neighborhood to go into by yourself for pretty much everybody. And there are unconscious, subconscious programs running the show. Whether you know it or not, neuroscience shows, it's like 86% of your thoughts are the same thoughts you had yesterday, and you're anticipating being somebody different or new today. If you're not going in there or, uncovering that veil and really looking at, well, what is the subconscious, unconscious programming that is running, you're really missing the boat.
Welcome to the Mindset Game podcast. I'm Verit Kogan, and it is such an honor to have Dr. Greg Eckel here with us today. Dr. Greg uses a unique combination of neuropathic and Chinese medicine and provides an array of tools to treat acute and chronic illness, emphasizing prevention and wellness principles. In 2001, he co-founded Nature Cures Clinic in Portland, Oregon, and founded bVital, a wellness and recharging center, in 2022. In 2023, Energy4Life Centers was born, and he merged both Nature Cures Clinic and bVital into one. Dr. Greg takes on a three-prong approach to healing. The goal is to detect the body's energy systems, correct the body's control systems, and protect the body's energy. And this is done through bioenergetics, light and sound therapy, and mind-body therapies. And I'm very, very excited, Greg, to have you here today. It's such an honor because many of our listeners are curious about longevity, about performance, brain function, and just well-being, right? Desiring to live a long, vibrant, purposeful, healthy life, a life well lived. And I know that that is something that you can help us all with. So thank you again for being here today.
Oh, well, thanks for having me on.
So how about we start with just a little of your story? Like, what got you interested in this, the energetic side of healing and, of course, longevity?
Sure. It's been so long. When I hear 2001 started my first clinic, it really does put a date on me, and it just seems like yesterday I started. I was a preschool teacher in Portland, Oregon in the early 90s, and I was Montessori teacher and watching 3 to 6 year olds being put on Ritalin at that point for attention deficit disorder and ADHD, which, was the beginning of that diagnosis. But I had one special boy, Michael, who I like to say included others in his learning. He was a rambunctious dude, like all over the place. And if you're familiar with Montessori, kids get to choose their learning, and the older kids teach the younger kids. It's a very beautiful system. In fact, I'm a Montessori child wannabe, and I put my children through that education because it was so magnificent of, the innate intelligence of the being to track their own learning. Well, Michael was rambunctious. And I remember, the first day he came back on medicine for attention deficit disorder, and he was slumped over in his chair, his shoe was untied, and that little light was gone out of his eye. And I thought, there's got to be a better way to help these kids rather than just drugging them. And, Ritalin, fast forward to today, like half the kids in the elite high schools in Portland are on these drugs, like just to keep up. It's, as if the social media and all of the programming are shortening our attention spans. Now, I too have ADD, ADHD, and most entrepreneurs do. And it is a superpower when used correctly, but that was inspiring to me of there's got to be a better way. At that same time, I was a 20-something, and I was a vegetarian, and I thought I was eating very healthy. My vegetarian diet consisted of beer, French fries, and frozen burritos. And so I did not have a lot of energy, as you can imagine. I went to the naturopathic school there in Portland. It's the oldest and best naturopathic medicine school in the country. And they gave me a diet diary, and they addressed my diet. They called me a junk food vegetarian. They gave me some botanical medicines, and my energy came back. And I had always thought if I was going to go back to school, that I wanted to be in service to people. So all these roads led into naturopathic and Chinese medical school. So it came full circle.
And I've heard you say that the future of healthcare lies in energy. What do you mean by that?
Yeah, so the future of medicine is frequency, sound, and light, and energy. So when you look at most chronic illness today, they're mitochondrial dysfunctions. Well, mitochondria, if you remember back to ninth grade science class, is the little kidney bean shaped organelle in the cell. And that is where ATP, adenotriphosphate, comes from. It's energy for our body. Well, you look at these little kidney bean shaped organelles, and they are receptors of sound frequency and light frequency, interestingly enough. And, this isn't just, it sounds really woo woo of like, oh, we're going to heal the body with sound and light. But there is actually some hardcore science behind this that these receptors, the more we learn about them, it's not just oxygen and glucose or ketones in and energy out. There's actually receptors for sound vibrations and frequencies and light to supercharge these energy factories of our body. So we're able to put in frequencies. And, it makes sense when you think, we have these supercomputers in our pockets now. And well, how does the information get there? It's on frequency. There's information traveling on wavelengths that get into that receptor that then interpret the data. Well, guess what is the most magnificent receptor in the universe is our body. And so if we're able to, get into those three levels of detect, correct, and then protect, we're able to supercharge our receptors, really open them up to receive the information and really perform at a really superhuman potential.
And what is some of the latest, like most fascinating, jaw-dropping research that you're aware of around this, around kind of bioenergetics and so on?
So I think the first thing that comes to mind are the med beds. There's always been this promise of a light bed that you go in, you're sick, you go into the light bed, and you come out the other side healed. I'm a big Trekkie Star Trek fan for those old enough to remember those, which I think is most executives these days. We all kind of grew up in that era. And it is, back down in the medical bay with the tricorder reading the body. Well, now have instrumentation that can read the biofield, the frequencies around your body before it gets compressed into matter or this dense matter state. So we're able to head off illness or prevent things from happening, but also we're able to reverse them. So the biggest one that I've seen lately is healing cancer with a med bed or a light bed at 200 to 400 hertz information coming in. It kills the cancer cells. The cancer cells destroy, and normal cells flourish. This is in a phase 2 and phase 3 clinical trial at the moment. That's not something that I'm able to advertise on the web because it's not done research. However, it is coming, and it's one of these tenets of longevity right now. The first tenet is don't die, because in this next decade, we are going to see a hockey stick. I mean, it is happening faster and faster, that change with the data collection and information being fed back into clinics where we're able to see some previously, pathologies that were deemed uncurable or as of yet unknown cure, now reversing. Yeah.
That's incredible, and I imagine brings a whole lot of hope to anyone who's currently suffering or, of course, wishes to get ahead of things and be able to prevent as much as possible. So we've had Dr. Bruce Lipton and Dr. Shamanijan on the show talk about epigenetics, talk about a little bit about the biofield. And what is most important, or what else is most important for our listeners to know right off the bat about the biofield and also as it relates to our beliefs, right? In terms of kind of the receptors on the cells that are able to pick up on environmental energy, including perceptions. What can you share about that?
Well, this I love their work, and we incorporate that work into. I've got the Eckel protocol for brain regeneration, and it's a biggie. Like what your cells are listening to all of your thoughts, and so the component of that is what are you telling them, right? I like to say this is a dangerous neighborhood to go into by yourself for pretty much everybody. And there are unconscious, subconscious programs running the show. Whether you know it or not, neuroscience shows, it's like 86% of your thoughts are the same thoughts you had yesterday, and you're anticipating being somebody different or new today. If you're not going in there or uncovering that veil and really looking at, well, what is the subconscious unconscious programming that is running, you're really missing the boat. So this whole aspect of superhuman or ultra human or just fully manifesting our greatness, we have to access that. So there are belief systems that we see. So one of my specialties is neuro regeneration. We're publishing on Parkinson's reversal, actually, hopefully before the end of the year. And this aspect of, well, what limiting beliefs are you carrying? Like I've had people in my procedure room when we start to say intentions for stem cell regeneration, and they break out in tears saying, I don't feel like I value myself enough that I should be healed. And it's like, how did we get this far in the process? So I've put a lot of things in actually in first contact with people. We start talking about it on webinars on what are your limiting beliefs? Because the people that I see heal actually they're not putting their diagnosis on, they're not living in fear, they're really excited about the future, they have a bigger future than their past, they've got purpose, they're looking at, it's that old adage that energy goes where your attention flows, so you're going to get more of whatever you're focused on. It's an interesting concept, but play it out and run that, get curious about it in your own life and see what happens. If you start focusing on the positive, you'll start getting more positive. If you focus on the negative, you'll start viewing more negative things. Now, this is not a Pollyanna statement of like, just think good thoughts. No, I'm talking about really getting at the underlying, the unconscious, the subconscious. There could have been, big belief, and actually just came out in research for neurodegeneration of traumas linked to increased dementias, Alzheimer's, Parkinson's, neurodegenerative states. Now, I've had that as a working hypothesis for the last decade in my programs here at Energy4Life Centers, because I see it. I see people don't identify with trauma, but we know from the adverse childhood experiences, the ACE scores, that no one gets out of here alive. And so it's really looking at and reframing and investigating that for yourself of like in your life, even ancestrally, how those things play in, but then really looking at and getting, that answer lies within. So actualizing your greatness, you've got to get in on the mindset component and really investigate that. It's a basic tenet, foundational piece of work for everything that we've done in 25 years. It is the most overlooked piece of healing.
Hmm. Thank you for sharing that. We've had different experts as well on the show, like Dr. Dick Schwartz, speaking about internal family systems and all kinds of experts on the kind of inner world, what the parts of us might be believing.
Mhm.
So when we look at it again through the lens of longevity, if there are parts of us that may, like, one of your patients, say, I'm not worthy of living longer, or I don't believe I can, or I might not be happy if I do, or something like that. What can people do to shift those mindsets?
Yeah, so a lot, I mean, definitely, I think getting a coach is important because it's a terrain that's wrought with a lot of pitfalls. So it isn't and the way that I would explain this, Varid, is it's fractal medicine. Like what resonates with you listening? Because it's going to be a different path for everybody. There's not just one path or this is the best route. It's what route works for you and your understanding and where you are at on your journey today. So there are a lot of different things like the internal family systems is great. General counseling, DBT, there's NLP, neuro linguistic programming. There's all kinds of different ways of, Bruce Lipton's Psych K is a great one. Sue Morter has her best training. And so there are different routes that you can go. Hypnosis can be very beneficial for some folks to kind of uncover and surface some of these limiting beliefs and or unconscious, subconscious programs that are running. I guess some of the clues I would say, rather than on what can somebody do, is to know if you continually have life experiences that you're not enjoying. And it's like, gosh, this pattern, like I have all this evidence over here to support the way the world is. Well, if you like that evidence and you like the way the world is showing up for you, then just keep gripping on to those belief systems that you have. If you're not liking the way the world is appearing to you, perhaps let's get curious and look at, well, maybe these beliefs that I'm carrying around aren't serving me anymore. They got you to today, but they aren't going to get you to the next level. It's like that Einstein quote of the level of consciousness that brought you the problem is not the level of consciousness that will solve that problem. You need a different level of consciousness. So, I'm fond of Dr. Joe Dispenza's work, the meditation there, any type of meditation, breath work, all of these things to help you regulate your nervous system, get you in touch with your intuitive self, and really ways to get you communicating with your emperor, empress, your heart. And I bring those terms up in a Chinese medicine fashion. There's no word for mind body medicine in Chinese medicine. It's all heart centered medicine. And I find that so beautiful because it is really, how do we utilize the brain, but really activate it from the heart? And that's my explicit message now is really what I'm doing every day is helping people get into heart and brain coherence, drop into their heart space and create from there so that we have more love coming through in this plane of reality here. Yeah.
Yeah, thank you so much for sharing all of these different options that people have at their disposal. There's so much help. And the important thing is to know that they can get some help to identify and shift those often unconscious programs. And that going into the heart, as you said, coherence and activating more of who, we really are, kind of our core, totally loving self, often has a self-healing mechanism, if you will, that can support. So, what other strategies, tactics, ideas do you have for people who wish to live a long life that is well lived?
Yeah, I think one is the detect component is what you don't know may be killing you. I think it's really important to get correct optics, meaning, if you're in your 50s, perhaps you've had some friends or you've known of people that have just drop dead of a heart attack. Well, I'm here to tell you that they had a lot of signs and symptoms along the way that they were just not paying attention to because they were never educated about it. And so we look at it, we're here in lovely Park City, Utah, where you bounce into Olympians and everybody is really out and fit and oriented towards a lifestyle. That's not the case everywhere. So what do you do? Well, there's blood work panels. There's functional medicine testing. We like to look at the microbiome. The gut is the second brain. Your digestive tract is really important for your health. You absorb all of your nutrients there. We screen for levels of toxicity. We, unfortunate or fortunate, we're very resilient beings, but we're also exposed to a lot of chemicals that are not naturally found in our bodies that can cause us a lot of issues. Heavy metals, molds, chronic viral illnesses are top three. Now we're seeing the microplastics building up in our bodies. Now, I don't say these things to bum us out. There's a lot of things we can do if we know we have them, and they're all reversible, actually. We also look at hormones. How's your sleep, the foundational, kind of the non-sexy components of, okay, well, how are you eating? What are you eating? How, are you moving your body? And how are you sleeping? I mean, there are basic components here that we know our bodies run better given the right information. And we have to remove obstacles to cure.
And are there any kind of latest and greatest advancements on longevity, in addition to, of course, early detection and prevention? Are there any things that people need to be aware of that they can access or, do on their own, in addition to, of course, nutrition, exercise, and sleep?
Yeah, there are a bunch of trends, what I call the flavors of the month. Being in medical practice for 25 years, I've seen a lot of fads come and go. And I will tell you, on the fad front, if there's any diet that makes one of the macronutrients evil, that's not going to last very long. So what do I mean by macronutrient? So there's proteins, there's carbohydrates like your vegetables and your fruits, and then there's fats. Those are the three macronutrients that we all need. Now, the carnivore diet is big, the keto diet is big, the Mediterranean, vegetarian, vegan. There's all of these different diets. And I'm a librarian at heart. So I used to work in the library at, it was NCNM, the National College of Natural Medicine. Now it's the National University of Natural Medicine in Portland. 5 stacks of diet books, from pre-1900s to today, from breatharian, fruitarian, all of the different macronutrient focused things. And they all serve a purpose at a certain point. However, the general guideline that I like is that 40, 30, 30, 40% is your complex carb, 30% protein, 30% fat. That is a really good way of going about it. We've got to get out of the middle of the grocery store where the ultra processed carbohydrate foods, the highly addictive, delicious tasting things that are designed to have us consume more, but they're not real food. So again, I know you asked me for the latest, greatest, kind of more of the sexy things, and I'll get there, but I want to make sure that we have those basics there. Is the food, and then nothing beats movement in longevity. And it is a move it or lose it type scenario. Like, we will start losing muscle mass as we age into our 5th, 6th, 7th, 8th decade. So muscle mass, you want to really, we all trained as children for sports, if you were into sports. And then, you get into adulthood and you're not training for any event. Well, what if I'm taking from Peter Attia, he's one of the longevity thought leaders out there, of, well, why don't we start training for the centenarian decathlon? Like, what do we want to be doing when we're over 100 years old? Well, for me, that's like picking up grandchildren and great grandchildren, throwing a suitcase above on an airline if we're still flying at that point. Maybe we're now teleporting. I have no idea. But I want to be able to lift things, right? And you want to be able to move your body, have your balance, have flexibility. and you want your heart to be well trained. So it's looking at your exercise routine to have some good resistance training, like actually put some steel or resistance on your muscles, because that helps your bones, it helps your muscle mass. And then some high intensity workouts of like where you get your heart going and you challenge it. I personally I like the Peloton bike because it's really easy. I can get in a 15 to 20 minute, concentrated workout. I use EWAT, exercising with oxygen therapy. So we have some things we stack on there. That one's kind of sexy. That yet we have a big bag of oxygen in the living room with a face mask. And so as you're doing your workout, you're getting 100% oxygen. That increases nitric oxide. It helps your blood vessels grow. It's anti-inflammatory. So, there are enhancements that we can do to some of the kind of the dreary things of like, oh, I gotta go do it again. But yes, you do. If you want your body to perform, you have to give it the right nutrients. So that's why I started with food. Then you got the movement. And then you can get into, intermittent fasting. There's some great research on that. Now, it is different for men and women on that front. So I think I've been switching my recommendations on fasting. So this is a caloric restriction or time restricted eating. It is shown as you restrict your calories, like any other organism on the planet, as you restrict calories, you'll extend life. So, we have 24/7 access to a bunch of food and we graze throughout the day. So if you're not doing any restriction or time restricted component, that's probably the easiest, lowest hanging fruit for you. But I would recommend not skipping the breakfast, but skipping the dinner, because the dinner tends to be the largest meal. There's this old time tested adage too, is like, eat like a king and queen for breakfast, a commoner for lunch, and a pauper for dinner. Now that's hard to do, and I will tell you, I have a hard time doing it as well, because you have social gatherings and more time in the evening to go out with friends and family. However, for women in particular, getting those calories in the morning and not skipping that breakfast has been shown to regulate hormones much better, and produce better energy and longer lasting strength as well. But everybody, when you read about it or hear about it, everybody says, oh, just skip breakfast and, go for lunch. It's kind of the easiest thing. That said, really, get educated about it, because you could do more harm than good on just a simple thing as like time restricted eating or fasting. All right, now you asked for the sexy stuff. So the components of what we have, we do bioelectric acupuncture. So creating fields around the body and measuring the biofield. So there is a lot more research, and I'm hoping that we get more research in this field of the biofield. There's a lot of research that comes out of Russia on Carillion photography, or reading the field around the body. And we have a voice activated scan that you count to 10. We're measuring not just the vagal tone on your voice, but we're using your voice as the microcosm to represent the macrocosm. So this component of units that we can measure. So we use the voice as measuring the field, the biofield, or the frequencies around the body. And we can then beam that into a light bed, the different information that has been found to be out of balance. We put that over to the light bed and then transmit the information on the light frequencies, red and green light, into the body, into the mitochondria receptors. So we've got some research coming out on that, measuring the mitochondria. Just in the last 2 years, this mitochondria test has come online, where we can really get some good information on how well your mitochondria are doing. So we're, on that front, testing different supplements and saying, these are supposed to boost your mitochondria, and they actually don't show any evidence of changing anything in your mitochondria, even though it looks good on paper, right? So we're doing that with the light bed. That is one of the most exciting things that I've got going right now. Um, the other, we use sound bowls, actually, the kind of crystal tones that have infused, they have different notes and different gemstones in them that carry different information in the sound wave. We then pull those into a procedure room, so individually handpicked for the person of what's resonating with them at the moment. And then we play that while we're doing laser activated and guided V cell, so very small embryonic like stem cell procedure. So we do an intranasal stem cell procedure and systemic stem cell procedure guided by a laser surrounded with frequencies. We also put Skinar technology in there, which is what the Russians take to space with their astronauts, more like the Star Trek tricorder component. Skinar technology comes, reads the resistance in your tissue, comes back to the device changes the frequency, it helps circulation and blood flow. So utilizing these different frequencies around the body to get different effects and changes in blood flow, in information, what's in the blood, and then really tapping into the innate intelligence of the body to heal. Because ultimately, that underlying foundation of how we're approaching this is the body knows how to heal itself given the right information. Now, occasionally we've got to remove those obstacles to cure, but by layering these things, putting in oxygen, so we do hyperbarics, we do ozone therapies, we do inhalation of structured water to help proteins reconstitute. There's a lot of different ways we can go from there. So whatever strikes your fancy.
Yeah, and some of this is just, it's just mind-blowing and the imagination of where it will get to, where it will go to, especially with, supercomputers and being able to handle large amounts of data that we may not have been able to do before. And, in one of our first conversation when we met in person, we spoke about Dr. Roland McCready out of HeartMath. And, we briefly spoke about, heart-brain coherence earlier on this conversation. And now you kind of brought us back to the innate intelligence of the body. How important is activating the heart? So kind of pausing to go inward, maybe label our emotions, and activate the heart. How important is that for our healing?
It's crucial because if you're not able to get into parasympathetic activity, which is a heart rate variability, a coherent state, your body isn't able to heal. So to say it a little differently, if you are in sympathetic or your fight, flight, or freeze mode of survival, that puts you back in your limbic and amygdala, the more the reptilian brain, which is survival. It's important to survive. But when you're in that reactive mode, your circulation changes. Your body is not able to heal because it's on high alert of the saber-toothed cat is coming to eat us and we got to stay alive. So we're not able to digest. We've got muscle, blood in our muscles and in our eyes so we can see the cat and we can choose what to do, but we're not actually able to rest and regenerate. That's parasympathetic. That digestion, the relaxed state of how the body heals. So to get into a heart coherent state is crucial. And I'll give you just a little research that is not published, but we were looking at absorption of IV nutrition in from IVs. And we would use a brain tap from Patrick Porter. It's an audio visual entrainment. It's kind of goggles and sound. So it's lights flashing on the eye and sound coming in the ears to put people into parasympathetic or a coherent state. And we would then measure urine output and flow, and we would show a 30% increase of absorption of vitamins and minerals in a coherent state. So as just a little piece of that puzzle of you're able to absorb more nutrients from IV when you are in a coherent state. It's just really profound, you know, to realize like, hey, we need to regulate our nervous systems better. We have not been taught how to do that. And in fact, I would argue most of the programming out there is to manipulate people back into their limbic system because then you're not accessing your full greatest potential and you're not able to drop into your heart. You're way easier manipulated and hurted because you're in reactive mode rather than really focusing in on the heart. It's that Cat Stevens tune, the answer lies within. And that's really, what I train my clinicians on is how do we have deep presence with people and really, ask those questions to get into the heart of the matter, because that ultimately, that's where we need to go. And that's what's been, pay attention to me, I'm out of balance. Well, the innate intelligence will continue to put up more and more symptoms until you're forced to listen to it. And sometimes that's too late, where it's like, oh, now I'm just suffering so much that it's hard to get back to Wellville. Yeah.
Yeah. I'm so grateful that, you're highlighting this for all of us. One of the things that we teach, listeners here is how to do what we call play. So it's just kind of pause, label what's going on in your inner world, activate the heart. So get coherent, activate, of course, the heart's guidance to be able to yield some of the over attachment, to cut through some of the over significance that we give to things, oftentimes from unconscious extreme beliefs. So when we do that as individuals, as patients, when we're working with a healthcare provider, and we're trying to assess what is the best treatment for us, what is the best supplement, what is the best, course of action with regards to our health. How important is it to get coherent and access the heart intelligence about that?
Oh, I mean, that is the thing. We need to quiet down to get into be able to remember to trust our intuitive selves. Like literally the answer lies within. We're all looking for that solution out there, but ultimately it does come from in here. It comes from the heart. That's why I love the Chinese medicine philosophy is there's no word for mind body medicine. It's all heart-centered medicine because the emperor or empress is so esteemed. It's follow your heart. Like we have all of these old adages that, we need to actually take inventory and tune in. And that's the slowing down of the breath, doing, I love that, the play acronym that you've got there. Whatever, again, those paths are going to be different for folks. Some people, it's more through movement, maybe it's more through breath work, or it's some, cognitive component, depending on where you're at, what's going on in your life. All of these things can be beneficial. Looking at the book, The Body Keeps the Score, is a tome, and it's utilizing all of the therapeutics because we are heart-centered dynamic beings moving through time and space. So really acknowledging that and finding a way, or providers to actually treat you like that rather than the reductionist pieces and parts model, which doesn't work very well for chronic illness. And why we see lifespan in North America dropping is because we are so far off of what we need to do for health. They don't teach health in medical school. It's all about pathology and disease process. And I go back to that statement of where your attention flows, the energy goes. And if you're just looking at the pathology and the disease state, you forget, or you've never learned, how do you promote health? And that aspect is, we have the blue zones that look at the 7 different criterion for the longevity of the highest concentration of centurions in these communities and what do they have in common, what's different. Community comes up there. So I love that you've got a community of folks that are exploring this together. That was the whole goal for our Energy for Life centers here in Park City, Utah, was to have communities come together, get their optics, go through. We have a 6,000 square foot facility of cutting edge therapeutics, go through a process, and then follow up through time on, well, what was that experience? And really going for, what are we creating? How do we change the world, in for ourselves on, what is coming at us, but then also our families and our communities and countries and then around the globe. I mean, ultimately, that's the ripple that we're looking to have here. Yeah.
That's right. And when you bring up communities, it reminds me of some conversations that we've had, for example, with Lynn McTaggart about collective intention.
Mm.
And with Roland on the Global Coherence Initiative, Global Consciousness Project, and kind of what happens when we in community get together with a collective intention. Maybe that collective intention is for one member of the group, let's say, who needs a healing, of some sort, or desires something in his or her life, or in a team environment, in a company, it might be collective intention for the highest good of the whole system. How important is that community and having a commonality in terms of intention and energetics?
So I'll give the example of the brain regeneration community that we've set up. So I treat a lot of folks with the diagnosis of Parkinson's disease, and there is not a lot of hope. So what we've put together is a coaching community for these folks where people are making different choices to get different outcomes, because you have to make different choices to get a different outcome. But you want to be surrounded in people that can support you in that effort. In fact, I even have a pom pom on my desk because I am a lead cheerleader, because it's not easy to create those changes in isolation. So it is having that supportive environment where, somebody else, you can popcorn ideas, you can get support. I mean, it was so lovely. I heard from one of our coaches that a family was going to, drive 3 hours away because, Billy Joe Bob was having a hard time, and they had met each other at the camp here, the brain camp. And I was like, wow, that is amazing, right? So here's somebody suffering in the community, and other folks online are saying, you know what, we're going to take them out to dinner. And I'm like, wow, like that level of support. So the same thing when you look at, so I'm involved with Dr. Hemal Patel, who's doing a lot of the research on Joe Dispenza's work with the mitochondria testing. I'm part of their medical advisory board down there. And looking at coherent healing, right? So Lynn has that power of 8. Dispenza's got, he'll do coherent healing during his meditation retreats. They're beaming intentions across the globe into cells that are protected in glass containers, showing changes that are appreciable in cell culture. We are just getting started in what that quantum understanding of reality is. And that really is what we're doing here, is a bioenergetic flagship of, well, let's just bring some of that new research into play with people and see, well, can we layer this on, traditional medicine, functional medicine, integrative bioenergetic, put it all together and see what kind of changes we can achieve. And so that it is those coherent healings. It's why distant prayer works. There's a lot of people think, oh, that is a bunch of hooey, but no, we actually have research to support those changes are happening. And it's real, and it's beyond just a coincidence or happen chance. It's actually intentional. And so as we wake up to that and more of us gain that frequency or understanding of frequency, I just think that the change is happening, underneath the surface. This is not being projected, in mainstream propaganda, because it's very powerful when you have a consciousness on the planet wake up to its ability to heal. That changes things rapidly.
Yeah, that's the hope.
Yeah,
Yeah.
it's
And
occurring. It is occurring. Yeah,
yeah. And it's really exciting that this research, I mean, you can't deny the research, right? And the more of it that comes out, I know there's a lot of research out of ions with Dean Radin and around energetics when send healing, love, intention, right? Attention
yeah,
and intention to individuals across the globe who may have anxiety or depression, and what happens when they do that, even when they don't know the individual,
right.
is really just phenomenal about when we are in our heart, right? Because be able to do that those people in your group that were willing to drive 3 hours, there's
Yeah,
a care and a compassion, that self energy, and that not only increases the frequency in their bodies, of course, and helps with their healing, it also has an effect, on those that they are intending the healing for. And what a beautiful thing it is to be able to unite in that way, in a higher level of consciousness, as Einstein says, to create new solutions, come up with new, communities, technologies, whatever it will take to bring even more peace into this world. So I'm just so grateful for the work that you do, along with many others like you, to advance this and to stay curious, and of course, to do your own inner work, in
right.
this. And how can people learn even more about, of course, your clinic and the many communities and programs that you have available?
Well, we have energy4lifecenters.com. So it's energy, the number four, lifecenters.com. I know it's a mouthful. We also have brainregen.com coming online. So that's specific to the brain regeneration component. I trademarked the Eckel protocol on that. We also have a podcast out there. It's called What the Health. And I've been podcasting for over a decade, interviewing. But online, those are the places to look. We're on Instagram, YouTube. I've got a longevity series on YouTube that was professionally produced. Pretty proud of that work too.
Well, thank you again. And on a personal note, a lot of gratitude for what you have taught me and our listeners here today, because it all takes each of us doing our own inner work, whether it's getting more sleep, better nutrition, learning about other things, sending more love to ourselves and to others. All of that helps to uh, raise the field, if you will, and create more collective healing. So thank you.
Well, thank you.
Hey, game changers, it's Vered. I wanted to pause and thank you for tuning in to this episode with Dr. Greg Eckel. If you want to learn even more about some options for, let's call it self-healing, some of those hidden secrets, about energy healing, about the power of thought, I invite you to tune in to episode 202 with Dr. Aaron Hartman. It's another great episode. So all my love. Bye for now.